Let's bring him in. Dr. Joe Congini joins us Wednesdays at this time for sports medicine from Akron Children's Hospital. Dr. Joe, what do you have for us this morning?
Hey, Rick, how are you doing this morning?
I'm doing terrific.
Good. You know, the Super Bowl Sunday, the NFL football draws to a close. Really now professional, college, high school football is off for 6 months. No meaningful football. There may be some of these alternative games, but 6 months now we're off of football. And I thought maybe we'd take a step backwards to some of the basics. Going back to the basics and a kind of 101 course is maybe down at our office, myself, my partners, seeing a lot of these overuse training kind of problems as people are inside training in the winter, and particularly to the growth plates in young athletes, and particularly the growing areas in young athletes. A problem called Osgood-Schlatter that everybody seems to know well, but there's a lot of confusion about how to treat it. And in the last few days and weeks, I've really seen some areas where there's some faulty ideas of how to train it, and that some tips that maybe we could give that could help a little bit with this. So, Ray, growing pains have been around a really long time. That's what these are. Back since our day, there would be growing pains. We would be between the ages of 11, 12, 13, 14. We'd be playing a lot of sports, and we'd be achy in our knees or our shoulder or our ankles. Many times those were growth plates. And in those days, what we did a lot was we just kind of backed down from sports a little bit, and most of the time those went away. But nowadays, what youth sports is like, and there's a lot of commitments that kids have to a lot of different teams and activities, and they really feel committed to having to try to play through this, and they continue to kind of make it worse, and they live with pain. A kid yesterday was telling me he was down visiting family in Columbus. They went to the Columbus Zoo, and he was limping around so bad they told him to get in a wheelchair to push him around with his knee from Osgood-Schlatters. So Osgood-Schlatters is a really well-known, really basic growth plate problem, and it peaks during the period of the major growth spurt. So some kids grow a lot at 10, 11, 12, 13, 14, and then by 15, 16, we start to see a slowing of that growth spurt. But a lot of kids just are miserable that whole time because their knees ache and they have problems related to involvement in sports. They get a painful bump below their knee, a painful area below the knee. That's where the growth plate is, and there's these microfractures in the growth plates where the tendons and the muscles pull on that growth plate, and the muscles and tendons are stronger at that time, so it hurts and aches all the time, and particularly in explosive sports, jumping sports. So at this time of year, what I hear the most, three things, definitely. Lots of kids playing a lot of basketball, no doubt. So basketball players having it pretty bad right now. Number two, a lot of this junior Olympic volleyball, JO volleyball, they play a lot of tournament games on a weekend, and I see kids come back with pretty bad Osgood-Schlatters. But even maybe more so is a lot of kids going into the gym to work out, and they go to these explosive training programs where they do plyometrics, which is jump training, and squats where they squat training. And with that, it puts a lot of stress on that growth plate, and they start limping around and having pain. Now, this is where the problem comes in, Ray, is how do you treat it? And so a lot of people just live with it, and they're miserable, and they go through their growth years hurting all the time, and that's certainly not the ideal way to treat it. Some kids go to see somebody, and they get started in a medical field, and they go to total rest. I see kids come in my office with immobilizers, which won't let the joint move at all. So they're walking around in an immobilizer, shutting down the joint for weeks at a time. And the muscles will actually get weaker. They'll atrophy, and they'll get very stiff. And so total rest is not the right treatment. And so kids will use braces short term, and that's good for the short term. It's like a crutch, can help you maybe get through a season. But it's not a forever thing with Osgood to wear a brace. The key is physical therapy, getting in and working hard on getting the flexibility and strength and the balance back into those muscles around the knee, up in the thigh, even in the core. And as those muscles get stronger, it really reduces the stress to the knee. But Of course, it's not instant gratification. On average, for me, an Osgood-Schlatter's plan takes about 4 to 6 weeks before kids will be getting better. 4 to 6 weeks isn't terrible when you look at a lot of other things that can be months of time. But, of course, kids don't like to back down from sports for that period of time. So we kind of have to talk to them about why that's important. When they do go back, we got to make sure it's not too much too soon or they'll flare up. But one good thing is once they get to 15, 16, 17, that bump they have never hurts it anymore because it's not an open growth plate. They may still have some tendon pain, but no pain over the bump. It's almost never needs surgery. But it's really not one of those things where kids should go through those years being miserable the whole time. And there's a lot of good things we can do in sports medicine. So this is basics 101 of sport medicine treatment. And if your kids are having growing-related pains or Osgood-Schlatters, get in and see somebody that can put them on a good game plan to get better.
Joe, let me ask you this. When do we know that it's a growth plate and maybe more? What are the ages that you see this growth plate pain? Is it 13 to 16? Is it more than that? Educate us on that side.
Yeah, really good question, Ray, and it's really, really variable. So that's why being in pediatric sports medicine, we're more aware because we care for these things, because there's growth plates in the shoulder, in the elbow, in the throwers, in the heel for kids who play a lot of soccer and stuff, and they're all different stages and ages when they get them. So it kind of, the body goes through this growth process kind of gradually, and we kind of know what that is. And so the ones in the foot and heel are earlier, age 10, 11, 12, and the ones in the knee more 12, 13, 14, and the ones around the hip are later, 15, 16. So it's different age ranges. And then, of course, to make it different is, this from having kids, is there's a lot of kids that are 12 or 13, and their body type looks like 15 or 16. And there's kids that are in their mid-teenage years, and they still haven't hit their growth spurt yet. So we kind of have to get a sense by where they are in that maturation process. And again, that's where I think your sports medicine professionals can really help you a lot, is the timing of these growth plate problems, as you very, very astute question.
All right, great information, education. Parents, pay attention to that. When they say aches and pains, give that a look, listen to them, and as Joe said, make an appointment with your sports medicine doctor. Joe, good information. Good talking with you again, my friend. We'll reconnect next Wednesday morning.
Thanks so much, Ray. Enjoy the week.